Well, welcome everybody. We're just 2 minutes after, and I don't see any others in the waiting room, so we'll go ahead and get started. Thanks for joining us today. I'm going to put a link in the chat once again. That link will take you to our website where you can see the recordings for each of the monthly webinars that we've done, in case you want to go back and watch any of the other presentations. Last month, we had a great presentation from Tintic School District on how they're using the tablets to do remote hearing screening assessments. So that was a really great presentation by Peggy Dressel. I also wanted to just mention as we get started, I've had a few districts reach out and ask me if we have any extra kits available. We don't right now, but we do have a funding request in with the legislature. It made it on the priority list, so we're just waiting maybe by the end of next week to find out if it actually gets funded. And we'll send out an email with some news once the legislative session ends. So we're keeping our fingers crossed for that. So thanks again, everybody, for joining today. We're really excited to hear from Aubreigh Parks in the Wasatch School District and Shelly Cooper with Intermountain Health about how they're working together to improve access to healthcare to students in school. So, and we do try to keep these meetings to half an hour. So I'll turn the time over to Aubreigh and Shelly and let you take it away.
Am I all right to share my screen then?
Yep.
Let's see. Let's see if this works here. Sorry, my spinning wheel of death is now moving. There we go. Okay, so I am super excited to talk to you guys about what we have set up in Wasatch with a little bit of data that we've collected so far. And I think that we're all on the same page that kids really do benefit from being in school. As nurses, we see this. We see the health impacts of gaining an education and staying in school. As parents, we feel this. Missing school or missing work is hard. When our kids have to miss school, we as parents have to miss work. And so what we've found is that the infrastructure that school districts are provided, either telehealth equipment that they've purchased on their own or through UETN or elsewhere, the infrastructure is really able to be customized to build a program that works best for you. Whatever type of vehicle you want to run on that infrastructure can run on that infrastructure. For example, you can use point of care testing, standing order medications. You can have scheduled visits. You can have acute care services, mental health services. There's all types of vehicles that can run on this telehealth infrastructure that's available. So our pilot program in Wasatch County started with standing orders in May of 2021. And just this school year alone, so from August when school started until the beginning of February, I made this presentation earlier in February, so some of this data is already outdated. But we have had over 1,200 medications this school year alone, and I'll talk about how that's impacted our education as well. But we also offered starting on November 15th of 2022, so this school year, we started offering point of care testing and telehealth with connection to a care provider. The telehealth aspect of it is such a fantastic aspect of our school-based clinics. I'm going to be showing you some data on 10 visits that we held from November 15th until about the beginning of January. Our standing order medications that we use for our school-based clinics that use telehealth, we have our no waiver medications. So these are going to be our first aid type medications, as well as our waivered medications. All of these medications we have an order for. So we still get an order for everything. We just have a standing order for medications that require parental consent. And those are going to be things like Bengay, Oragel, hydrocortisone cream, different types of eye drops, cough suppressant, Tylenol, ibuprofen, Benadryl. We only use liquid Benadryl, and then Tums and albuterol, the standing order albuterol. We also have just like our general like epi and saline and bacitracin that we just use for first aid. We chart our medications in SIS, which is our student information system, when we have a student who comes in and wants a standing order. So they are at school with a headache. They come in, they would ordinarily have gone home because they don't have a prescription for Tylenol or ibuprofen. We begin our standing order process. The nurse receives a phone call. We make sure the parents have a waiver filed. We put the order in as nurses and our health aides. So like our unlicensed assistive personnel go in and they can see the order, which is this top part here. They see the order that's been put in. They then dispense the order and they note which nurse authorized it, which parent authorized it, and what they dispensed. And then there's also a visit connected to that medication administration as well. So our standing order medications really do keep a lot of kids in class. What we have found is that by and large, our ibuprofen and Tylenol medications are administered more often than anything else with this. It's great to have the telehealth capability with this to an RN for this, because when in doubt, we're able to get a visual assessment on that student. But we have some pretty clear parameters as to when a child can or cannot give medications as well. We do use point of care testing with our program as well. We use the Sophia 2 machines. We received these machines through grant funding through the Utah Department of Health. And we use strep A tests that we pay for ourselves. And then we get through grant funding through a COVID grant, flu A/B and SARS-CoV combo tests as well. We also have urine dipstick tests to test for urinary tract infections. And those are super easy to use. And then we use a glucometer. We just use a super simple, easy glucometer as well. So our telehealth equipment that we use is similar to almost everybody in the state, which is the GALE units from 19 labs. And this would be what I'm referring to as our infrastructure. So we can use this infrastructure to connect RNs from the school, or also to local providers. We do not have nurses in our schools. We have health aides in each of our schools. So the school health aide is the only person in our schools that use these. I know that there are other schools that choose to use these with secretaries if they don't have health aides. Super user friendly. And any provider, we allow any provider to use our infrastructure. And that's really important for our community, to be able to access their own pediatricians, their own nurse practitioner that they normally see. So any provider is able to use or drive their own vehicle on our infrastructure. But we make it clear that they have to have an MOU. So we have to have an agreement that we are not responsible for billing, but we'll help them collect that billing information at the time of visit. And we also require a charitable visit contribution to participate. So if a provider wants to see their patients on our infrastructure, they need to provide us with some amount of charitable visits as well. So for a lot of our providers, this is somewhere between 10 to 15 free visits a year. And as RNs, we determine who is eligible for these, and it's generally based on free and reduced lunch or high deductible insurance plan or no insurance. So on the 10 visits in this month and a half period that we looked at when we were building this presentation, 60% of those visits, so 6 of those visits did not miss any days of school at all because of telehealth. Telehealth was able to get them a prescription for antibiotics. 100% of our visits received a prescription. So 60% received a prescription, but were able to stay in school. 30%, so 3 of those visits received a prescription and needed to miss the rest of that day. And they were back the next day. So this would be our strep kids. They were able to get those 2 doses of antibiotics in time to return to school the next day. One of our visits was not able to return for a full day of school. And this was due to a superbug lice situation. And actually the student was eligible to return, but parent elected to keep the student out of school. In our telehealth visits, we've had 60% of the visits parents did not attend. They were at work, they were busy, it was inconvenient for them to attend, and they authorized the visit without their attendance. We were actually surprised at this. We thought parents would want to attend every visit, and that has not been the case. Only 40% of our visits have been attended by parents. And one of the things that we have just been so excited about is the impact to attendance. And this is something that makes administrators and school districts really excited. So the average time for the standing order portion of our school-based clinics, the first time a student comes in to get medication, they're usually out of class for 22 minutes. Every subsequent time, it takes less than 10 minutes to get them back to class. And that data is kind of dependent on age. Our younger kids are closer to the 10-minute mark, whereas our older kids are lower to about 2 or 3 minutes. Our telehealth visit time on average is about 60 minutes that a child is out of class. And this is a number that we're seeing go down as we're learning the technology better. A lot of our data, or a lot of our hiccups in time, have just been due to trying to navigate the connectivity to providers and make sure those kinks are worked out. On average, it's taken about 30 minutes from when we decide to start a telehealth appointment with a provider to see a provider. And again, this is time that is gone down in trend with each visit as well. And on average, our telehealth visit length from when we see a provider to when the child is returning to class is 20 minutes. So of all of our kids that we are seeing in our school-based clinics that are eligible to participate in one of these, either in standing orders or getting a point of care test or telehealth, all of our students who receive a standing order, 95% of our students who receive a standing order return to class who would have otherwise been sent home. So it's keeping 95% more of our children in school who were being sent home before. That's huge. We have 100% parent satisfaction with anybody who has used either standing orders, point of care testing, or telehealth, and 100% teacher and administration support at this point too, which is pretty amazing, quite frankly, for anything health related in a school system. So a couple case studies just to give you a picture of how this works. So we had a 14-year-old male student who came to the health office with a little fever and a sore throat. The parent requested a strep test, and so the strep test was actually completed by the health aide. The nurse called the parent with the results, and the telehealth appointment was requested by the parent, but they expressed an inability to pay. So the nurse determined that this student was available for financial assistance with a visit. The waivers were signed and the visit was initiated. During the visit, the student received a prescription. The parent did not miss any work and also was able to attend the visit virtually from work. And the student missed the remainder of that day, was able to get 2 doses of medication in, and so could return the next day to school. This was also, the parent happened to be an employee of ours, so it was a double whammy good fortune for us, because not only did this student get more attendance than they would have had they gone somewhere else, but we did not have to pay for a sub to come in for that teacher. Case study number 2 was an 8-year-old female who presented to the health office with left ear pain. The health aide initiated a telehealth visit with the nurse on call, and the nurse identified that there were signs of an ear infection noted. And the RN called the parent, who said that, we can give this kid some medication and we can also initiate a telehealth visit. It looks like that ear might be infected if you're interested. The parent did want to do that, but was not able to attend the visit. They were working in Salt Lake and it was going to be challenging for them to attend the visit virtually. So we got the waivers signed, connected the student to telehealth. The RN attended that visit with the student. They used Medicaid for billing, and they received a prescription to their preferred pharmacy. The student received ibuprofen and returned to class that same day. And the parent picked up the prescription on the way home from work. The student never missed a day of school. So 2 great outcomes. We have used telehealth for UTIs, strep throat, pink eye, ear infections, a lot of strep throat this year. So it's been really awesome. So a couple of critical aspects as you're considering how you might implement this into your own school and what things you may want to use. Obviously, getting orders in Utah is really important. We have, like I said, our own standing orders that we use that include both our first aid medications as well as our standing order medications. You'll notice if you are using standing orders for ibuprofen and Tylenol in your district right now, your weights are probably much lower than ours are. Ours are clinical based weights. So if we dose off of the weight of the student, not off of the age of the student. We also would need consent. So we require consent from the parents that is written, consent from the parents that is verbal at the time of service, and consent from the RN at the time of service. And this is critical to making sure that this goes smoothly. We have two different types of consent forms that we use. We have a consent just for telehealth, and this includes billing information that the provider might need. But we also have a consent just for our school-based health center. And this would include our things like our standing order medications that a student would possibly use, as well as our point of care testing. And is the parent interested in receiving telehealth? We use a program that's electronic called Sign Now. Sign Now is both HIPAA and FERPA compliant. And we have a district account with Sign Now. It is fantastic. It automatically saves our files in a secure location for us. So it has nearly eliminated the paperwork that is required. We use this Sign Now for everything from our asthma action plans to our waivers and consent items for the telehealth clinics. Another critical aspect is making sure that the people that are driving on your infrastructure know how to use it and when to use it. So we built algorithms for all the different, oh my heavens, the different reasons that a student might come into the health office. So this would be an algorithm for sore throat. Up at the top here, you'll notice different keys. This top one is different ideas of standing orders that you may request from the nurse. These are different ideas of point of care testing you may request from the nurse. And is this a telehealth eligible visit? So a student that walks in with this, the person who is caring for them can follow this algorithm, and it gives them some ideas as to whether or not a nurse could help them, or if they could benefit from involving a nurse in this care. And then also connection to a healthcare provider. Without a connection to a healthcare provider, our clinic would do far less good than it already is. We have been super, super grateful that we've had really good success. One of our easiest providers to connect to is Connect Care. I'll let Shelly kind of talk about that for a moment.
Okay, thanks, Aubreigh. Can you hear me, Aubreigh? Can everybody hear me? So.
Yes, we can hear you, Shelly.
Okay, great, thanks. Well, so Connect Care has they actually really love this program. It took a while to get it implemented, but I just heard yesterday that the providers really enjoy seeing the students and the outcomes that they've had by seeing those students within schools, and they actually quite enjoy being able to think that they're starting to fight over who gets to see the students in the schools, but they really enjoy it. But so after the intake questions are filled out, which includes, those intake questions include some information on insurance information, which is vital for billing purposes, and the consent is filled out. The telehealth presenter, which is the health aide in Wasatch, but in other school districts, you could have the nurse, or you could have a secretary, or whoever you chose to be the telehealth presenter, literally just clicks on a button and can connect with a Connect Care, the Connect Care clinic. And once you enter that clinic, the telehealth presenter is able to chat with a patient service representative through Connect Care. And that patient service representative, we call them PSRs for short, they will start to create an encounter based on the information that was taken on those intake questions. And then while this is happening, while the PSR is creating this encounter, which it doesn't take very long to create an encounter, the PSR notifies the Connect Care provider that there's somebody in the waiting room. And Connect Care providers are acute care providers. Currently, we have been chatting about being able to have scheduled visits, and that's probably something that will be implemented later on once the volume increases. But currently, they're acute care visits. So while the PSR, after the PSR notifies the provider that there is a student waiting, the provider will review the information that was collected by the health aide, which could include if there was point of care testing completed, any pictures, pictures of a throat or anything like that, or inside the ear to just diagnose if there's otis media or anything like that. So the provider will review that and then join the call. And they'll join, and they can also, so sometimes there's always the health aide, there's the provider. With Wasatch, the nurse joins the call as well, and then the parent can join. And we also have the option of having language interpretation join the call as well, if you have students that need language interpretation. But once the provider reviews the health information, chats, has a visit with the student and whoever's present for the call, if they need more information, the health aide will gather more information. But if they don't, the provider is able to diagnose and treat for a variety of conditions. And Aubreigh has pulled up the different conditions that Connect Care will treat over the school-based telehealth program, which they have actually, the providers have actually changed what they'll allow because of this program, and it's been for the positive. It's been a benefit. So the provider will call in the prescription to the parent, the student's preferred pharmacy, and then the parent can pick it up. And then after the visit is complete, billing takes place. The providers bill the insurance, and there's also financial assistance available. One of the goals for sure with this school-based telehealth project is to decrease the time of the telehealth visit, and we are actively pursuing that and starting to do that. So that is what happens on the Connect Care side. So Aubreigh, feel free to.
So just a couple things that we've found like to consider as you are looking at building or how to use your equipment similar to the way that we are using ours. Managing flow and the time to visit. In the beginning, we're like, oh, you have an ear infection, let's treat you now. Well, now we're like, no, let's dose you with medication. We'll see you at 1:30 when our day has slowed down a little bit. And we're pulling students back at slower times of day. We don't always need to do everything right when the student comes in. The right to privacy. We've installed privacy curtains for students in our health offices so that if they're laying there waiting for the doctor to get on or the provider to get on, we can put a curtain around them. RN coordination, we have a great RN team that takes turns with call and it has not been a problem, but having an RN group that is willing to participate in this program is important. Parent education, just getting this knowledge out to parents is one of our hugest hurdles, I will say. And what we have found is every parent who hears about it is excited about it and wants to do it. But it's so novel that a lot of them don't understand it until we have time to talk to them. So we just continue to get as much FaceTime with parents at various PTA nights at the schools, at registration, we have flyers. So the more time that we spend talking to our friends and neighbors and at school events, the higher our enrollment has gotten. And then just our time to registration, just making sure that we get more and more students registered earlier in the school year so that they take advantage of it earlier in the school year would be beneficial. Any questions for me? That's all the data I have for you for today.
This is Brian. Aubrey, just really quick, those flow charts that you have and the consent forms, are you willing to share those with the group so that others could take advantage of that or have a template to go off of?
Sure, I am willing to share it. It does have like our RN call phone number and stuff on it, but it'll give you a great idea if you want to kind of edit those as works best for your school.
Yeah, that's really what it is. It's kind of a template. Thank you.
And I would say that on the telehealth consent, other than the different providers, there's key wording on that consent, that telehealth consent that needs to be there. So if that's something, if you're wanting to use an Intermountain provider, we just make sure that we review that before you send that out to parents, because there is specific legal requirements on that telehealth consent.
Yeah, that's good to know, Shelly. It's probably something good to review with your local physician, whatever physician that you want to use to work through that process. Thank you. Thanks for that reminder, Shelly.
Heather, do you have a question?
Yes, I was wondering if parents are sending students to school sick and then asking for a telehealth visit.
Nope. No, they're not sending kids school to sick any more than they have any other year.
Okay. And what's your Title I numbers in your school district?
So we have, COVID killed Title I. I'm sure you're well aware of this. COVID killed Title I because so many students didn't have to apply for free and reduced lunch. So we have 5 elementary schools. 2 of our elementary schools maintained their Title I. We have one that it should be Title I, but we just lost our Title I designation. I think they will return to Title I though. So over 50%, I would say, of our population, of our numbers are Title I students in elementary school.
Okay, thank you.
I think somebody has their hand up, but I can't see who it is.
Yes, it's me. Thank you. This is amazing. You guys have really checked all the boxes and nailed it. So strong work. I have one question. What kind of trainings do you guys provide for the health aides in the schools?
That's a great question. So our health aides have, we are so fortunate to have incredible health aides. We have gone back and forth. We've had health aides now for 5 or 6 years since I started working in Wasatch. We brought in health aides. When we started, I said, I only want CNAs or MAs. What I found is that actually didn't help me. I found that I needed to just hire the right person and provide the training.
Okay.
So we will hire, technically, you have to have a high school diploma and CPR certification. But our training program is pretty rigorous. So we actually have scheduled training that it takes them a full year before a health aide is considered out of orientation. And so our health aides are paid a little bit differently than our reading aides. They're still paraprofessionals, but they are the highest level pay of a paraprofessional. So they're considered a paraspecialist, and they are paid at the same rate as a health or as an aide that would be in a severe special ed classroom doing lots of intense hands-on stuff. So we do a pretty intense 2-day before school, all day training for them for 2 days. And then we have weekly virtual meetings with them, a training meeting weekly, and monthly we have an in-person training meeting with them. And then they have assignments that they do each week that we give them at these training meetings. So we may say, this week we're focusing on diabetes. This is where you need to go watch this video, go take this quiz. And then a nurse is assigned to each health aide. So each nurse has about 3 or 4 health aides that they round with each week.
Okay, and that was going to be my follow-up question is how many nurses are in your nursing pool?
So we have a supervisor, which is myself, and then we have 3 nurses, and we have 9 locations.
Okay.
So each nurse has 2 to 4 locations, depending on how we've divided it based on kind of, various things.
That's awesome.
Any other questions?
Aubrey, one of the most common questions we hear around the state is if districts want to work with providers, how they'll handle the billing. And you covered that, but maybe just touch on it one more time, because I think it's really important how you said that you don't have to do the billing
Oh,
as,
no.
as a district. So can you just kind of briefly cover that one more time?
Sure. Yeah, I am not in the business of billing. Never will be. So the way that we did it is we went and visited a lot of the providers in our local area when we were considering starting this program and asked what their concerns were and if they would support or be interested in seeing their patients. 100% of the providers we saw were excited about it and wanted to participate in it. So much so that every single office we visited said, let me get my billing manager involved in this. Let's see what we can do to make sure that this happens. What we found is every office wants the same information. They want to know, does the student want to cash pay or does the student want to use insurance? And so every office that we met with, we said, okay, listen, if you're going to cash pay, you got to give us the same amount as everyone else. What we're finding is up to $69 is fair. So you've got to bill, we're just going to say it's up to $69 that you can bill for cash pay. And then we collect the insurance information on that consent form and we let parents choose. Do you want the provider to bill you with their insurance? Do you want the provider to bill you at a cash pay rate, which is up to $69? Or are you concerned with your ability to pay? And at that point, we would say, okay, we're gonna put this under a financial aid with this pediatrician who's given us some visits, and we just keep track of that. So when it comes to billing, the only thing that we keep track of is we have a shared spreadsheet that we track how many free visits we've given out to which providers. So it's super slick. The providers love it.
And on that consent form that they fill out, there is a question about if financial assistance is needed.
Mm-hmm.
So that helps alert at least with Connect Care, that alerts us if we need to provide financial assistance for that student.
Awesome. Yeah, that's a great model. Thank you for sharing that.
Hey, Aubreigh, when you were talking to the physicians and you had that conversation of some free healthcare, was their reaction always pretty positive with that as far as an exchange?
Yep, it was 100% positive in that all of them were willing to provide some free health care. The only differing factor I had is I had a couple of doctors say, well, before I give you a firm number, right now I can give you 10 free visits, but depending on how many paid visits we get, we might be able to increase this number. Okay. So I didn't have a single provider that was like, oh, well, then count us out. We're not interested. The reality is, for a lot of these providers, these are their patients that they're seeing and they want them well taken care of. And they know which of their kids are not paying their bills anyways. And this is a much faster and cheaper way for them to see them than coming in and taking valuable office time.
Absolutely. On a follow-up question with that, have you had any issues with some of the, obviously the Connect Care, you've got the depth of physicians or the depth of resources to be able to get there. With any of the other people that you've reached out and had contacts with, have you had any delays of service? I heard one of the things that you said was send the student back and have them come back at a slower time, for you and your convenience. Have you had any issues with being able to, hey, we've got a student, they want to check it with their primary care provider, but trying to find a slot or a time is somewhat difficult for that to happen?
So every provider wants to do things a little bit differently in kind of how they work their office. But generally what we've done is we've based it off of when we as a school have availability. We know in schools, we're very, very, very busy during lunchtime. That is our busiest time in a school setting. And so we just have made it a general rule of thumb that we just don't do telehealth visits during lunch. And so even if a student presents during lunch, we can give them medication, but we can't get them connected to a visit during lunch. So I was referring more to our side of things. We do have a pediatrician locally that's like, if it's an ear infection or a positive strep test, I don't need to see them. I just need to see the pictures and I need to see the positive result. Send me over the telehealth request email, let them know what it is. We can do a quick phone call. We can still bill it as a telehealth for this student and get them the prescription the same. So we do have some providers that are like, yeah, let's get them in and get them out. We don't really this is an unnecessary amount of time. Whereas others really do want to see them face to face.
Thank you so much. That was very insightful.
Any final questions for Aubreigh or Shelly? Well, Aubreigh and Shelly, thank you so much. This has been amazing. You're doing just amazing work. And we did record this and we'll post it on our website at that same link that I put in the chat. I'm sure a lot of others will want to watch it as well. So again, thank you. It's great to see how well the program is working, and I'm sure you'll get follow-up questions because you're just doing amazing work.
Thank you.
Thanks, Matt. Thanks, Matt, for having us.
Hey, Audrey, will you have Matt's email? Is there a way that you can get those PDF'd or emailed to Matt? And
Yeah.
then we can find a way to be able to provide those for the rest of the nurses throughout the state that want to have access to that. We already have some resources, but those additional resources would be awesome.
Yep, no problem.
And if you're willing to share slides as well, I can post the slides along with the recording.
Okay.
Okay, thanks everyone. Have a great rest of your Friday and great weekend.
Okay, thank you.
Thank you.